My name is Muyingo Yusuf, and I'm the Secretary General of Uganda Medical Laboratory Technology Association. And as well, I'm working at HuQAS Hospital as the Laboratory Quality Officer. We are going to discuss together the findings in our study about the prevalence, bacterial profiles, and factors associated with surgical site infections in antenatal mothers, post-cesarean mothers at Kawempe National Referral Hospital. Why Kawempe? Kawempe is a national hospital for women who are pregnant, and it calls for women from all over East Africa. If I say all over East Africa, it even calls for the entire Uganda. Therefore, that's why we picked interest in Kawempe, but it is under a complex hospital called Mulago National Referral Hospital. When we talk of Mulago Complex National Referral Hospital, it has 4 arms. It has Specialized Women Hospital, it has Kawempe, and it has Mulago National Referral Hospital itself. Because you would find that where we're going to see in some of the ethical considerations, the study was reviewed in Mulago, and then you will wonder why in Mulago yet we are speaking about Kawempe. Those are co-authors, and I'm presenting it today. I'm glad to be here. I think we can go next. It's noted that globally, it's around a third of mothers who get cesarean section, and out of them, we are seeing that there is a prevalence of 11.8. That is globally, and that is inclusive of Uganda, the 11.8. And in sub-Saharan Africa, you find that it is around 20%, which develop surgical site infections. And in Uganda, you will find that it has a range between 15.5 up to 33.3%. That's a range. And the current prevalence is 15, but the range starts from 2, according to different studies in Uganda. And by then, and up to now, because my study is not yet published, you'll find that the data available is insufficient. And that's why we picked interest. Next. Our general objective is very clear, that we wanted to know details of the bacterial profiles, prevalence, and the factors associated. And you'll find that 12%, as stated earlier, of mothers who undergo surgical site infections, they end up what? Dying. And 7.03% was also stated way back in 2012 that it was a prevalence of surgical site infections in Uganda. And in 2013, it was around 20.4. But when we came to 2020, it was a general, including all mothers and other individuals, showing a percentage or a prevalence of 85% of surgical site infections. And that called for an attention for us to carry out this study. It is due to this increasing number of prevalences due to surgical cesarean sections and other surgical operations that we picked interest in it. Next. General objective, it is very clear. I think next, we go to the specific objectives. We wanted to determine the prevalence of surgical site infection in post-cesarean mothers at Kawempe National Referral Hospital, as well to determine and identify the possible bacterial profiles from those exudates extracted from the post-Caesarean mothers. And as well, we were interested in determining the factors associated with the surgical site infections. And lastly is to determine the antimicrobial activity of those isolated bacterial profiles. In our study, which was carried out in Kawempe National Referral Hospital, we used a cross-sectional mode, and the study population was very clear. All those scissored mothers who had stayed for a maximum of 30 days after the cesarean section, because we expected that those mothers, after 30 days, if they develop those infections, they are not due to the cesarean which was done. Next. The selection criteria was very clear, and we picked interest in mothers from age of 15 to 49. Our reasoning was mothers below 15 years, we don't expect you to get pregnant normally. And as well, after 49, we expect those mothers to must have gone in what? Okay. We expect those mothers to must have gone into menopause. And our exclusion was as well very clear, that those mothers who had stayed after 30 days, then those who were very ill, and we could not collect sample from them or get consent from them, we did not include them in our study. The sample size was 202. That's the sample size we used. Sampling method, it was convenience. We did not use any other method. We used convenience, that is non-probability sampling method. And we collected the swabs from mothers from all corners, like the endpoints of the cesarean, whether vertical or transverse. We collected from all corners, but using one swab. They were transported using couriers, and we were putting their ice packs to make sure that we maintain the temperature of 2 to 8. Sample processing was done in microbiology department, that is in Mulago. And among the data collection tools, we used the interview guide, where we could ask a mother some questions, and as they are responding to us, to say that we can be able to get the associated factors. Then to get the bacterial profiles, we used the inoculation of BA and clade. Then for sensitivity patterners, we used the Kabeba method using Mueller and Hinton agar. Next, for evaluations, all cultures made on the agar plates were examined macroscopically, and we performed gram stain onto not direct, indirect gram stain. That is after culturing, to make sure that we identify the gram reaction of those significant organisms which had grown. Then we performed biochemical tests according to the isolates on each specific plate. And furthermore, we did the sensitivity on MA, on Mueller and Hinton agar, and we used a number of antibiotics according to the recommended profiles for each organism. Analysis was done electronically. However, factors which were factors to be considered significant, we considered a p-value of 0.05. Then to make sure that we employ quality in our procedures, we made sure that we have complete interview guides. As well, we used specialists in the microbiology lab to make sure that we analyze those samples alongside with them. And then we had reference organisms we used for comparing the identity of what we had isolated. And we had to follow the operating procedures which were in place. And finally, we used electronic mode to enter our data, and that data was entered in a duplicate by using 2 individuals to enter that data. Ethical consideration, our journey was a little bit long, and we first thought review from approval from the faculty committee, and then we went to Mulago Research Ethics Committee, then we went to Kawempe, and we had to make sure that our clients do consent, and as well we had to make sure that all these documents which we used are kept confidential to only those who were responsible for the study. Data dissemination, it is still ongoing, but we had to deliver the outcome of the sample analysis to doctors in Kawempe, postnatal ward, and then we had to deliver a dissertation to Mbarara University of Science and Technology, then a dissertation as well to Mulago National Referral Hospital, then to microbiology department, and as well we have applied for publication of this study, and we are presenting this study in the forthcoming conferences, but as well we have so far presented in 2 international conferences this same study. These are results, and as we are all aware that we recruited 202 mothers in this study, and most of them, they were between the age of 16 to age of 42 years, and 183 mothers, for them they were married, and 120, for them they had a minimum education level. Not all mothers who were recruited that they were married. The prevalence of surgical site infections in this study was stood at 30.7%. Next. And these are some of the bacterial species identified, but you will find that Staphylococcus aureus was the most identified, followed by the coagulase negative Staphylococcus. And among the gram negatives, we had Klebsiella and E. coli taking lead, among others. And among the factors, we found out that there were 5 factors which were significant. And the first one was if it was the first time of that mother to get pregnant, you could stand few chances of getting surgical site infections. And as well, if your BMI was not overweight, you could stand lower chances of getting surgical site infections. As well, those mothers who experienced more than 2 vaginal examinations, they were standing at high chances of getting surgical site infections. As well, we found out that those mothers who were operated transversely were less likely to get surgical site infections compared to those who were operated vertically. And science or anatomy and physiology, they are those integuments which take long to heal, and they are the probable cause of you getting the infections. And those who had not yet taken treatment before surgery, they were also standing high chances of getting surgical site infections. This is a graph which just shows a specific organism vis-a-vis the most sensitive antibiotic against each. We are seeing that when it comes to E. coli, we are having gentamicin and imipenem taking lead in being the most sensitive, As well, when we come to Klebsiella species, you could find that we have Argentine, and imipenem as well taking lead. For other gram-negative isolates, you could find that still Argentine and imipenem is taking lead in being susceptible to these organisms which were isolated. Next. These are 4 gram-positive isolates, and it is a radar chart. You could find that vancomycin and clindamycin were the most sensitive, where you find that 17 of the organisms were sensitive to clindamycin, and 17 of the organisms identified were as well sensitive to vancomycin. That stood it to be the most sensitive. And the most resistant was ciprofloxacin, cefoxtin, and gentamicin. Those ones, they were resistant. Next. I think it was as well clear that our prevalence stood at 30.7%, and these were disagreement according to the 2 studies done in Uganda. One was being done in Hoima Regional Referral Hospital, then another one was in Sub-Saharan. But why was it in disagreement? You find that in Sub-Saharan Africa, there were a few countries considered. One was Congo and TZ. They were the ones considered to call Sub-Saharan. Then when it comes to the one of Hoima, as I stated earlier, Kawempe is encompassing a big population of mothers compared to Hoima. That's why our prevalence currently is bigger than that did by Muhumuza. Then for bacterial species, you find that in most of the studies, they were occurring with us, that Staph aureus among the gram-positive is the mostly isolated, and E. coli among the gram-negative. But you find that a study which was done in Tanzania, for it was saying Pseudomonas aeruginosa. But according to the way when we are reading literature there, it was the issue of a nurse who was cleaning the wounds of the mothers who could transmit that Pseudomonas from one patient to another. Next. Then among the factors, there is a lot of agreement, and for transverse, I talked about it. Then for examinations, I talked about it as well. Then prophylaxis, this was due to failure. Uganda system, health system is a little bit dwindling, but it needs our prayers as well. But there were challenges of delivering those drugs by then, and that's why it is causing so. It caused so in Hoima Regional Referral Hospital. Antimicrobial activity, it was in agreement for coliforms that imipenem was the most susceptible to all, and then for Staph aureus, it was just in disagreement. For us, we were saying that clindamycin and vancomycin was the most susceptible, but study did in Mbale and Hoima, for them they were having other factors. However, there is irrational use of antibiotics in the central region compared to other regions of the country. That's why it was differing. In conclusion, we stand at a greater height, saying that there is high prevalence of surgical site infections in post-cesarean mothers in Uganda, and if you have multiple parities, you also stand at high chance of getting surgical site infections. As well, if you overweight, and if they examine you more than 2 vaginal examinations, And as well, if you don't take some treatment before operation, you stand high chances of getting sepsis. And we recommend personal genital hygiene. And during our study, we found out that mothers could take time without cleaning themselves. And there is mandatory administration of antibiotics. But as I stated earlier, the health system, this is limited because of that. Ensuring maximum attention to mothers with multiple parties, and as well the lifestyle change to minimize that weight gain. Aseptic vagina examination practices, because it may not be stopped, or it may not be prevented for you to be examined more than 2, but at least if they are aseptic, we think that it can reduce on the surgical site infections. As well, limiting the vertical incisions was one of our recommendations. And we request that further studies can be done involving theater and area space, because you never know, it may not be due to the mother and the nurse, but there may be other causes, like in theater where they have operated the mother from, if those organisms came from there. The limitations were not too many, and I think it is very clear because we used the cross-sectional study. And this is an acknowledgement that I've been given an opportunity to present here. That's why I acknowledge HuQAS and then Mbarara University, because that's where our study could mean a lot, because it gave us again in Bachelor of Medical Lab Technology. Association where I come from, and I'm the Secretary General. Then Mulago National Referral Hospital for analysis and giving us the ethical approval. And lastly, it is Kawempe National Referral Hospital, where we gotten the mothers to work on. And then Choko Hospital, where I work as a quality officer. Thank you, members, for listening. And as I'm closing, I think you can wind up with the last slide, where we were. That shows the practicability of what we were doing in this study. Otherwise, thank you.